Healthcare is confusing. Payer policies change, regulations are modified, reforms are proposed. We're breaking it down for you here on Inside Healthcare from Fulcrum Strategies. Today on the program,
Now, what we need to do is make sure that we are supporting programs that help the American people. We're making sure that people have affordable, quality health care across the country, and we're keeping the government open. Something very achievable to do.
Hello, everyone, and welcome to Inside Healthcare from Fulcrum Strategies. I'm Matthew Handley. With me, as he usually is our President and CEO, Ron Hourigan. Ron, hello.
Hello, how are you today?
I am doing well. Our government appears to not be, as last night they could not agree on a continuing resolution to keep the government funded, and as such, the government shut down at midnight last night. There's a couple of questions that we want to address today about this particular issue, and part of it has to do with what happens to payments to physicians under some of our government programs, but also what exactly are the Democrats using to try and hold this up. But let's start with the first one, Ron. One of the concerns that I think some physicians might have is what happens to Medicare payments. Obviously, Medicare being our government system of healthcare for our seniors and some with disabilities as well. Does Medicare payments fall under mandatory spending?
Yeah, they do. I mean, whenever this comes up, everybody gets worried about Medicare payments. They get worried about Social Security checks. All of those things will go out. There will be no hiccup in those. Those have to continue to be spent. And they happen, and they're fairly automated. So that's not a concern at all. That will continue to go. And even if the shutdown lasts weeks, I think the last one lasted like 7 weeks. So there's no concern there.
What about administratively, employees at the Centers for Medicare and Medicaid Services? Are those going to be, will there be customer service issues if providers are having issues? What does that look like?
There definitely can be. There's like 400,000 government employees that are deemed to be essential, which means they have to come to work. They're just not going to get paid. That's the obvious ones, the military, TSA agents, FBI agents, et cetera. Not all of CMS is considered mandatory or essential. So there could be some hiccups in, standard customer service. The operational stuff, sending checks, et cetera, that will keep going. But other things could fall by the wayside.
Yeah, that's good to hear. I know some of the concerns over what the president has said over his decision to possibly fire certain individuals over this. Of course, we'll have to wait and see what happens with that. But it's sounding like providers who are seeing patients with traditional Medicare are going to continue to get paid.
Yeah.
Just to sum it up.
Yeah. And obviously the MA plans aren't impacted by this at all. So the Humanas, the United Medicare, the Blue Cross Medicare, they're not impacted. So all of that stuff will still run.
One of the things the Democrats are concerned about, and one of the reasons they wouldn't support any continuing resolutions, is they want to see some extensions to the ACA subsidies that were implemented under the American Rescue Plan, as well as the Inflation Reduction Act. Those are set to expire at the end of the year, and my understanding is that there will be some premium increases for a number of people that are on Affordable Care Act plans. So let's start with that. Is in addition to that, are there any other consequences to patients who might be on some of these ACA plans come the end of the year if this is not changed?
Yeah, and I think that's the big one. And that seems to be one of the biggest holdups is the Democrats are saying that to do a CR, we want to have, and they're asking for these, these enhanced tax credits, subsidies, if you will, to be made permanent. Right now they sunset at the end of the year, but really this issue needs to be handled probably before November 1st, because they're about ready to do the open enrollment and enroll people and tell you what your premiums are going to be. So they need to get this figured out before all that happens. That seems to be the big hang up. I think it's like $358 billion over 10 years. That's what it's been scored at. I've seen a lot from the Republican Party saying, hey, we're willing to talk about that, but we don't want to attach it to the CR. We'll deal with it later. That's a huge issue, because if they don't extend those credits, conservatively, the estimates are that starting in January, about 4 million people will peel off those exchange plans. They'll basically say they're too expensive because premiums for them will double what they have to pay. The other problem with it is it's sort of the wrong 4 million people, because if you're very sick or you have chronic disease or whatever, you're going to pay that premium because it's still in your, financially, it's better for you to do that. If you're the 25-year-old male that's getting insurance because, hey, it's pretty much free in the exchanges, you're that young, healthy person, and you're facing inflation and everything, you're going to likely drop off. And unfortunately, what that does is you get rid of young, healthy people, and that starts the death spiral. In insurance company, the death spiral is when you lose all the young, healthy risk. The remaining risk is very expensive, and you've got to increase premiums. You increase premiums, and then you lose more young, healthy people, and it starts this, this horrible death spiral. So there's a lot of people that are very worried about what's going to happen if those young, healthies leave the exchange plans, and will insurance carriers just drop out of that market? So that's a big issue. I think more than the $358 billion over 10 years is what's going to happen to that marketplace. And then secondarily, where are those people going to go when they need healthcare? Well, they're going to go to the ER. You add that to the projected 11 million I've seen 11 to 15 million people that are going to lose their Medicaid coverage in 2027. And we could be staring at an environment where in a little over a year, 2027, we're at 45 million people without insurance in this country. We haven't seen that since 2010. And that will put a huge stressor on rural hospitals, the emergency rooms, because that's where that care is going to go back to. So, I think obviously this is a political football. Both sides are trying to score points with it. But from a healthcare perspective, the people that we serve, it's a lot bigger than that. And this thing could be a significant issue starting next year and definitely in 2027.
And when it comes to provider payments on these, I mean, if you have more, obviously, if people are going to fall off the exchange and either go uninsured, it's going to mean fewer payments for the providers. It's going to mean exactly what you said. That patient's going to show up in the ER if something happens, and I would imagine chances on collecting on some of that is going to be very, very small at best.
Yeah, I mean, it is. And it'll create some significant issues. For some physicians that are primarily outpatient elective, dermatology, they don't see a whole lot in the ER. They don't get a lot of, they'll be able to do it just fine. They'll just have patients that, they'll either have to pay cash or won't be able to see them. But for obviously the hospitals, hospital-based physicians, and really all of the other specialties that have to cover call at the hospital, even if you're not a radiology group or an ER group, you're going to take call for your specialty at your hospital. You're going to provide care. Could be emergency surgical care, could be just a consult, and you're not going to get paid for it. And right now, there's not a whole lot of excess money running around the provider community. So it's at that stage where this last little bit could hurt really bad.
And it seems like we talk politics on occasion. It seems like this is a little bit of a game of chicken here about who's going to crack first. I know in the last test vote last night, there were 2 Democrats that voted with Republicans and the independent senator from Maine as well. But it sounds like both parties are really towing the line here of what they want to do. And again, it's throwing people in the mix that don't necessarily want to be thrown in the mix. Anything else we need to keep in mind about some of these ACA plans and the result of this government shutdown for providers?
Well, I think, the big piece is whether those tax credits are going to get extended and, what that's going to mean for people dropping off the rolls. Obviously, if they don't get extended and their people drop off the rolls, if you're providing care for some of these people, you're going to have to really be careful of the eligibility starting in January, because you may have a patient that's been covered for the last 2 years and suddenly becomes uncovered because they drop off those rolls. So that's going to be a critical piece. But I guess, it's sort of a question for you, because you're as much of a, political wonk as I can be. If you were in Vegas handicapping this thing, looking at both sides lining up for an apparent fight, I have a hard time sort of handicapping who I think will blink first, because to me, this seems like almost a test case for the midterms. The midterms, it's going to be about Medicaid and healthcare, the loss of healthcare on the Medicaid people. But this almost seems like a little trial balloon fight. And I'll tell you, I'm interested in I'm not sure how I would bet on who's going to blink first.
Right.
What's your
Well, and
thoughts?
part of the issue is that you have the Democrats do have the I don't want to say the uneducated the position on here, because they can run around saying that Trump has the White House, Republicans have the House and the Senate, although
Right.
the Senate requires 60 votes to pass a budget, and
Yes.
there's a
Yes.
very slim majority for Republicans in the Senate.
Right.
So that's what creates a little bit tricky here. I know Schumer caved last time, but some of the things I heard before are that because he's up for reelection in New York, this is why he's taking such a hard line on this one, and that he might be primaried by someone more progressive, like an Alexandria Ocasio-Cortez. But you're right;
Yeah.
it's hard to try and put some money down on this one to say this side's going to win here. It does look very bad on both sides. I mean, if you can make a good argument on both sides for who's at fault here, and
Yeah.
it will be interesting to see how this affects. And of course, Congress has never been popular anyway, so it's kind of hard to lose even more popularity that you don't have with the American.
Yeah, but you bring up a good point. I mean, this because it needs 60. This could come down to one or two votes in either party, and there are I think, some interesting votes. You got Schumer and the challenges he's got, and the pressure to sort of hold the line because of it was viewed that he folded last time. You got Tom Tillis, who in my state, North Carolina, who's a lame duck who didn't vote for the big beautiful bill, and what's he going to do? You got Cassidy in Louisiana, who is in a world of hurt because of his support of RFK Jr., and he's a physician, and physicians are angry with him, and there's talk about him being primaried. You've got Barrasso in Montana, who's another physician. In the House, you've got a number of physicians. So this one, and then you've got the most unpredictable president we've ever had, and that's not a political statement. That's just the reality of every time he steps to a podium, everybody holds their breath and wonders what's coming next. And for me, that kind of uncertainty and difficulty in planning, I think, must make it difficult for the strategy arms of both parties to sort of know what to do. And I guess if I were in Vegas doing the over-under on, say, 4 weeks of shutdown, I'd take the over. I think we're going to be down for at least a month, because I don't know how they're going to be able to, wrestle all of that together and figure out a cogent way to exit the stage when they both have taken very hard lines. So we'll see how good of a odds maker I am, but that's where I'm at.
Yeah, the over might be the way to go on this one, and we'll touch base on that, and we'll have it on a future episode if we're still shut down and we're still seeing what happens. Because you're right, November 1 is that magic deadline of making sure that patients are aware of what kind of what kind of ACA plan they can get in their state. And I know I'm aware too, and I know we're running short on time here, but a lot of these states, their marketplace has already been gutted. They're in North Carolina, if I recall correctly. In a lot of counties, it's just Blue Cross Blue Shield.
Just Blue Cross.
In Michigan, that's the case too. And that creates even more of a strain, I would imagine, if you take some of these subsidies away, about who's going to step in and create some of these ACA plans in their areas.
And there's no law requiring Blue Cross offer. So what happens in a state when Blue Cross is the only one and they go, we're out, and there isn't an insurance option? We could see whole counties or states lose it. So yeah, we got to keep an eye on this, and we'll keep our finger on the pulse of it.
All right, Ron, I appreciate your time today.
Great. Thank you.